prednisone taper trap. Are you stuck in the prednisone taper trap? I know I was stuck in the prednisone taper trap. You might be wondering, what is the prednisone taper trap? I'm Dr. Megan, the prednisone pharmacist, and I took prednisone for a long time. And the taper trap is the reason why we need to taper. But what is tapering? I'll explain that in this video. And I will show you how to use a prednisone taper chart. And you can even print one off my website really easily. I'll show you how through this video. So, prednisone was a miracle for me. I took prednisone and it allowed me to not bleed to death from a condition called ITP. My immune system was attacking my own platelets and I could have bled to death if I didn't take prednisone. So what my doctors would do is give me a high dose, say 40 milligrams, and my platelets would be down here at 5 or something really super low. And so as they kept me on a high dose, my platelets would go up. And so they would try to decrease my dose of prednisone. And then my platelets would go down. And then they would taper my prednisone down so that I didn't have so many side effects. And then my platelets would go down. And then they'd try a little bit lower. And then my platelets would crash. And so I was stuck in this taper trap. They would do it again. They'd go back up to 40 milligrams and try to get me back down and back down. And my platelets would go up and then they would crash. And then they'd have to go back up. And I just went on this roller coaster doses from 40 down, 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 down. And then my platelets following high, then low, low, crash. Roller coaster. So the taper trap is when you are stuck, when you can't get any lower. For me, that was often somewhere around 15 milligrams, where my platelets might stay high, but I was suffering so many side effects. And so for other people, it might be that their rheumatoid arthritis, they can actually use their hands, but and the side effects aren't too bad. But if they get any lower than that, then the side effects come back, or they're not able to use their hands. It's just a really tough situation. So I'm going to tell you the story of a guy named Matt. That's what we're going to call him. It's not really his name, but we'll call him that because I want to protect his privacy. So Matt is a really important person. He owns a business where he supervises 30 people. And he can't just be sick. He needs to be there to run his business. So when he came down with a sinus problem where he's tried everything from nose sprays to nasal flushes to prednisone, and the last resort is surgery. He can't take 2 weeks to have a surgery. So he's taking prednisone as the alternative to keep him able to breathe at night. If he doesn't take it, he gets so congested that he can't sleep. So the prednisone, for most people like me, it doesn't let me sleep because it causes racing thoughts. But for him, the prednisone caused decongestion so he could actually breathe. So with Matt, it's this really tough situation. He has to be on pretty high doses to get all of that decongestion, but it's causing moon face and weight gain and all sorts of other side effects. And I had to go through this with him. Where is the dose that you find the best balance of being able to breathe, not having too much congestion, but not too many side effects? And it's a really tough spot to find. For every person, it's different. For me, it was around 15 milligrams. For him, it might be around 25 milligrams. For a lot of people with rheumatoid arthritis, it's often closer to 5 milligrams or 10 milligrams. It's really dependent on your condition, your body, the level of inflammation that you have. Tapering is so essential, but based on the research I've done, it's not really a science. Like, they've tried to do studies to find a perfect tapering schedule, and they couldn't find one. And so it's more of an art than a science. And fun fact of the day, tapering is the #1 reason people contact me for a side effect consultation as the prednisone pharmacist, because it's so hard to do. It's so hard to have a doctor who has the time to be able to help you find what dose to take when. And so there are websites that can help you navigate this you can link to it in my article, or you can use a taper chart. So a taper chart, let me show you. You can download this exact taper chart off my website, and you go throughout my website. I've got a whole bunch of different strategies you can use. There's this short-term one, there's long-term, there's even slower, there's one that takes 1.5 years. It's really dependent on you and your condition, where the withdrawal syndrome kicks in. And what is withdrawal syndrome? So withdrawal syndrome is where your body is going through withdrawals from prednisone. And it feels awful, and it's really hard to diagnose because it looks like everything else. It looks like the flu. You might get a fever. You might feel totally exhausted, fatigued, achy, like muscle aches, joint aches, like you would if you had the flu. You got run over by a bus. You might get sweats. You might get all sorts of really weird, non-specific symptoms that could even be confused for COVID. It's just crazy. So when that withdrawal kicks in, that's your adrenal system has to recover from taking prednisone. Your adrenal, hypothalamic, pituitary adrenal system, your HPA axis, has to kick back in so that you start making cortisol again. Your body has been not making cortisol while you've been taking prednisone. It's been replacing it. And so you have to be able to allow your pituitary gland, your hypothalamus, and your adrenal gland to get that system re-engaged so that it can actually start excreting cortisol. And then the rest of your body has to get out of prednisone withdrawal. It's a really unique, patient-specific art of finding that balance, that speed that you can go down in doses. So knowing that we're trying to balance prednisone withdrawal and your condition, those are the two things. We're trying to find a balance. When is your condition going to get out of whack, or when is your prednisone withdrawal going to kick in? And that is the taper trap, is when you can't go any lower and you have to go super slow or go through pure misery of adrenal withdrawal syndrome. And there's never a good answer, okay? Like, I can help you find the best balance, but there's never a black and white, like, this is for sure what you should do. It's always okay, let's find the lightest gray that we can find. It's really a tough thing. So based on this, I give you a whole bunch of things on my website, and then you can print it out. And when you print it out, you can just go here to the printer button, and I'll just do it right now. Why not? Print it out, and while that's loading, we can keep looking at this one. And then I've got it so that there's the days of the week and what dose you should take. So if your doctor said, okay, I'm going to taper you down from 40 milligrams, here's one way to do it. Now, I want to make it perfectly clear that I am not replacing your doctor. I am not your medical provider. I am all the legal things. This is just an example you can follow, okay? This is not medical advice. This is just a service I'm trying to provide because I get asked so often, and I think it's really important that people have something that they can use. And so this is an option, but your doctor and you need to work together to find the very best solution. I am not replacing your doctor. So based on that, here's an option of what you and your doctor could work on. You could print this out and say, hey, doctor, what do you think? And they can approve it. So what you would do is print it out. So now that I've got it over here, I could push print. And you can print any number of pages. So I don't really need this first page. I really want to just do, I'm going to be starting at 40 milligrams and I'm going to do a short term, maybe. Or maybe I want to do this long term. Or maybe I'm going to do this really super long term slow one. So I'm going to just do this short term one. And I can just print, let's see, this is page 2. So I can just print page 2, whichever page you need. And now it's going to come off my printer. And while it's coming off my printer, I'll keep going through this with you. Can you hear my printer kicking in? All right, so here it is, the prednisone taper chart. And that's kind of loud, sorry. I'm going to grab it. Here it is, prednisone taper chart. So once you have it, you can use it. You can put your prednisone bottle right next to it and mark it off. So for example, if you had been given 40 milligrams and your doctor said, okay, take 40 milligrams every day for a week. So then you start on Sunday and you just go, okay, I took my Sunday dose. And I always recommend to take it first thing in the morning with some food, but you don't have to. And then on Monday morning, you can say, okay, I did Monday. And then you get through that week and then you start another dose down to 30 milligrams. And that's a typical one, 40, 30, 20, 10, 5. So you could do that. You could follow this plan, but maybe you get to 10 milligrams and you're like, I can't drop to 5. I can feel that withdrawal kicking in, or I can feel my condition coming back. Those are the two things, withdrawal kicking in or condition coming back. And so you can't go that fast. You can't drop 50% in 1 week from 10 down to 5. That's just too dramatic for you. So you could try this one. This is a longer term taper. So it's just dropping about 20% per week. And so you'd go down, boom, boom, and you can do a week of each of these doses. Now we're at 1 milligram per week dropping here. That's definitely doable. Here is that taken, instead of per week, we're talking per month. So you do each of these for a week. So month 1, you're doing 20 milligrams. Month 2, you're doing 17.5 milligrams. And so you just go all the way across. Week 1, week 2, week 3, and week 4. So if you don't want to do it for 14 months, or maybe you've already gotten down to 10 milligrams and you don't need to start at 20 milligrams, well then just ignore this part and just start at 10 milligrams. Make this work for you. This is just to make it as easy as possible for you to remember what dose to take and when. Then we have the alternate day strategy. And so this one is if you are super sensitive, if you cannot drop even 1 milligram a week. So then here's a suggestion. You could go 10, 9, 10, 9. Taking 10 milligrams on one day, 9 on the next. And then the following week, you hold that lower dose at 9 milligrams. And then the next week, you would do 8, 9, 8, 9, 8, 9. And then the next week, you could hold it at 8 milligrams. And maybe you have to hold it longer than 1 week. That's fine. You could hold it for 2 or 3 weeks at that lower dose. Just slow and steady wins the race when it comes to tapering. So then you would just keep following this plan, 7, 8, 7, 8, and then 7, and then 7, 6, 7, 6, 7, 6, and then 6, and then 6, 5, 6, 5, 6, 5, and then 5, and then 5, 4, 5, 4, and then 4 milligrams. And you just keep dropping until you get to 1 milligrams. And then, congratulations, 3 cheers for you. You're finally off prednisone. So I've shown you in this video how to taper prednisone using a taper chart and what to look for. Your condition coming back or withdrawal syndrome kicking in. And you can follow any of these taper charts that you work out with your doctor as the best for you. Signing off as Dr. Megan, your prednisone pharmacist. I'm committed to helping you thrive while on prednisone, not just survive the side effects.